Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I am Farah Nuriswarin. I'm a medical student in Faculty of Medicine and Health Science, Islamic State University of Maulana Malik Ibrahim Malang. At this moment, I would like to talk about ectopic pregnancy. An ectopic pregnancy is a condition that the fertilized egg implants and grows outside the main cavity of uterus. As we know, that the normal pregnancy, the egg implants and grows inside the uterus or womb. In the most cases of ectopic pregnancy, it occurs in fallopian tube and other areas just like ovary, abdominal cavity, and also cervix. An ectopic pregnancy can proceed normally. The fertilized egg can survive, and the growing tissue may cause life-threatening bleeding if it left untreated. Yeah, this is the difference between the normal pregnancy and ectopic pregnancy. As we as we can see, in the normal pregnancy, the embryo implanted normally in the uterus or in the womb, and in ectopic pregnancy, the embryo is implanted outside the uterus, just like in cervical, in peritoneal, interstitial, abdominal, ovarian, infundibular, and others. And then the risk factors of getting the ectopic pregnancies are previous ectopic pregnancy, inflammation or infection, fertility treatments, tubal surgery, choice of birth control, just like using IUD, and also smoking. Okay, the next is the pathophysiology of ectopic pregnancy. Actually, the pathophysiology is still unknown, and the mechanisms responsible for ectopic implantation are still unknown, but there are some possibilities that can cause the ectopic pregnancies, just like anatomic obstruction to the passage of the zygote, and abnormal conceptus, abnormalities in the mechanisms responsible for tubal motility, and transperitoneal migration of the zygote. Okay, the next is diagnosis. This is when there is a patient comes with the signs and symptoms with abdominal pain, irregular vaginal bleeding, and other symptoms just like shoulder pain and gastrointestinal symptoms and syncope. It may be ectopic pregnancy, but these signs and symptoms are similar with another clinical conditions, so it must be tested with HCG test and also USG to determine if this is ectopic pregnancy or not. Okay, now I would like to share the histopathology finding of ectopic pregnancy. Here, this we can see the fallopian tube. Yeah, we can zoom right here. We can see the normal fallopian tube. This is inside the fallopian tube. We can see there is abnormalities. Yeah, this is fibrin. And we can see the blood here. This is the abnormalities. You can see blood here. This blood here. Okay, this in this side we can see chorionic villi, and that contains the trophoblast. Yeah, there is bleeding here, bleeding here, so it is an abnormalities. Yeah, this is bleeding again. There are so many bleeding. Okay, we can back to the PowerPoint. Okay, and the next is the prevention. Actually, the prevention is just prevent the risk factor because uh, the the main prevention is we can we cannot do anything to prevent the ectopic pregnancy, but we just can avoid the risk factor. Okay, what we can do is limiting the number of sexual partners and using a condom during sex. It helps to prevent sexually transmitted infections and may reduce the risk of pelvic inflammatory disease. And the second is don't smoke because smoking can increase the risk of getting ectopic pregnancy. Yeah, the last we can see the sayings from Quran Surah Al-Bursalat chapter verse number 21. فَجَعَلْنَاهُ فِي قَرَارٍ مَكِينٍ. Then we placed it in a secure and safe place. This is womb. So Allah said that the womb or uterus is a safe place and also strong to the babies to develop or grow. And in this topic, in ectopic pregnancy, the babies are growing in outside the uterus or womb. So this is an unsafe place, just like in the first slide, first slide before, just in the ectopic pregnancy, there is no possibilities for being survived. So it is already explained in the Surah Al-Mursalat, verse 21. Okay, thank you so much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.